They promised us mental health was a top priority. Then they fired the very people who made that promise real. That blunt sentence is ricocheting across Michigan State University's campus right now, and it's the emotional spark behind a fast-growing online petition that has already collected more than 1,370 signatures in just a few days. The petition's target? MSU's decision to lay off key staff, including the beloved former director of Counseling and Psychiatric Services, CAPS, Dr. Swapna Hingwe, and to dismantle part of the psychiatry team that thousands of students rely on. But here's where it gets controversial. University officials insist these cuts are not a betrayal of their mental health commitment. Instead, they frame the layoffs as a simple restructuring within a broader 9% budget reduction mandate handed down by new President Kevin Guskowitz. According to spokesperson Amber McCann, psychiatric care will still exist, just delivered by MSU Healthcare rather than by the in-house CAPS psychiatrists students have known for years. CAPS itself, McCann says, will continue offering counseling and therapy sessions. Sounds reasonable on paper, right? Yet students, faculty, and even some off-campus clinicians are calling that explanation a dangerous sleight of hand. Their argument boils down to 3 gut-level fears. 1. Continuity of care will shatter. Students who finally built trust with a specific psychiatrist may now be handed off to an outside provider they've never met. 2. Cultural competence could evaporate. Dr. Hingwe's supporters emphasize her culturally attuned approach, vital for international students, students of color, and LGBTQ+ Spartans who already feel marginalized. 3. The message is louder than the memo. When you publicly proclaim mental health is a priority and then eliminate the leadership team most associated with that mission, students hear a very different message. Budgets beat brains. And this is the part most people miss, the timing. MSU's Counseling and Psychiatric Services became a lifeline after the February 2023 mass shooting on campus. Overnight, CAPS transformed from a quiet support office into a frontline trauma response unit. Students who had never considered therapy suddenly lined up for help. Now, just 2.5 years later, the university appears to be shrinking the very infrastructure that absorbed that surge of pain. Who actually wrote the petition remains anonymous, and the university has not disclosed how much money these layoffs will save, fueling suspicion that the cuts are more symbolic than fiscally meaningful. Meanwhile, Lee Norwood, Hingwe's direct supervisor, was also laid off, sending waves of concern, the petition's phrase, through the remaining CAPS staff. Let's zoom out for a second. MSU isn't the only school tightening its belt. Universities nationwide are slashing non-academic departments to balance budgets battered by inflation, enrollment dips, and frozen state funding. But mental health advocates argue that cutting psychiatric services is uniquely short-sighted. Every dollar trimmed today, they warn, risks ballooning into crisis-driven expenses tomorrow. Emergency room visits, academic withdrawals, or worse. So is MSU simply making a tough but necessary financial call? Or is it quietly backpedaling on a promise that was plastered across brochures, websites, and commencement speeches? The petition minces no words. It is deeply ironic and profoundly disturbing that even as administrators pledge to strengthen student well-being, they have removed one of the most trusted leaders in campus mental health care. Controversy check. Some administrators privately argue that outsourcing psychiatry to MSU healthcare could actually improve services, shorter wait times, access to specialized medication management, and integration with primary care. If that's true, why not announce a detailed transition plan, complete with town hall meetings and student input? Silence, in this case, feels like gasoline on an already blazing rumor mill. Your turn. Do you believe a university can claim mental health as a priority while laying off the very clinicians who deliver that care? Or is this just pragmatic budgeting that critics are turning into a moral panic? Drop your take in the comments. Agreement, outrage, or nuanced middle ground. Let's keep the conversation as open as the counseling door should be.